get started now. So I hope everyone is comfortable enjoying and not too hot. I want to make sure you're in the right webinar location here. This is the NOWIC First Monday Roundtable, and this Monday we're going to talk about strategies to measure satisfaction and experience with your worksite health center. So the format of our roundtable is that and today I'll be your content leader. I'll be providing about 20 minutes or so of background and content on the subject. And then what we're going to do is go around the table for everyone who's on the call and ask for your input, your experiences, your advice, any questions you've got that you want the group to respond to. I want you to take advantage of this as a real networking opportunity for this particular topic. For those who may not be as familiar as others with our organization, the National Association of Worksite Centers, NEWHC, or as I call it, NOWIC, we're the nation's only nonprofit organization supporting public and private employers and union sponsors of on-site, near-site, mobile, and virtual health centers. We also have all the industry supporters, the third-party vendor service providers and health providers that manage these centers. So we're really kind of a Switzerland and an industry group. We assist employers, hospitals, consultants, others to understand the value and capabilities of worksite centers. We offer education, networking, benchmarking, and a variety of other resources. And you can always go to our website or LinkedIn group to learn more about us. So with that, I want to let you know about some of the upcoming programs. Later this month, we've got a conference in Chicago, the On-Site Employee Health Clinics Conference. Members of NOWIC get a $250 discount for that. We don't manage that, but we do help promote it, and I'll be speaking there as well. Also, we'll have a webinar on using data to integrate population health strategies in July. We've got our own annual forum on August 22nd and 23rd in Indianapolis. I hope everyone will attend for that. We'll then have webinars in October on obesity management. And in November, after the election, we're going to have a session on the election and legislative update and what it means for employers in the worksite area and vendors as well. So with that, so there's many ways you can measure the performance of your worksite center. NOWIC recommends what we call the value of investment or VOI approach rather than just an ROI. And so because we think that you need to take a look at all aspects of how the worksite center and the value it can bring, not just the cost savings. So we're talking about areas of like access, clearly capital recovery on the cost, higher engagement and other kinds of benefit programs, medical and drug savings, reduction of unnecessary care, reduction of emergency room and urgent care use, increased use of preventive services, improve quality, lowering of health risks, reduce absenteeism, reduce productivity, improve recruitment and retention, and of course, satisfaction with the center. So this roundtable is just going to focus on looking at that satisfaction experience area. So there's lots of ways you can drill down in any measurement approach. And really, it varies on a variety of things. How long has the center been opened? How much data do you have? What's your interest in drilling down? So every employer handles it a little bit different. Every vendor handles it a little bit different. So you need to come together with your partner and decide, how much do we want to look at? Where do we want to look at? And how much data do we have? Some of the health systems and providers use other kinds of tools like they use in the hospital or medical group settings like Press Ganey or CAPS, but I'm not going to go into those areas. Very few of our members are utilizing those for worksite center satisfaction, so we're going to spend more time on the other areas. So how do you define what you want to look at? What are the things you want to cover in a survey? Now, you can do a broad general survey as, do you like the center? Would you recommend it? Or you can really drill down to get a better understanding. And to know what you want to look at, you've got to find out what's the clinic manager saying? What are the providers talking about? What issues have been raised by the family members or the workers, those who are eligible to use the center? Are there concerns about the account management between the relationship and the employer? What are other stakeholders talking about? Are you getting the kind of deliverables that you're asking for, both from the patient side and the employer side? Is the reporting clear on your satisfaction results? Are you getting it in a timely manner? What's been the positive and negative feedback that you've got from people? What's the general perception, the word of mouth view, and what was promised during the initial contracting and what was required as well? So when you look at the background, you should get an idea of where you want to drill down to. And so when you look at satisfaction, it's more than just satisfaction, it's also patient experience, because these things really do influence each other and they overlap in many ways. And the way I would define it is patient experience is really what happened while they were getting care. How did it happen from the patient's viewpoint? While patient satisfaction is, what were their expectations in dealing with their problem? How was it treated? Has it been resolved? What's their overall experience with the care? So when you're looking at patient satisfaction, you're drilling down into asking about treatment and care, the quality, the service, and the outcomes from the patient's view. You're also, though, going to be asking them, well, what was your view of the providers and staff? What about the respect you received, the time spent? What about the communication skills? How easy or difficult was it to enroll into the center? What about getting an appointment? How long were the waiting times, both in the waiting room and once you got into a treatment room, how long before you saw a provider? And what about the follow-up care? So when you're looking at patient experience and satisfaction for an overall score of what's going on, you really kind of need to combine these areas. And there's lots of ways you can measure it. Most are using what's known as the net promoter score, net performance score, NPS. It's usually from 1 to 10, and people are asked, overall, how would you recommend the center, or would you recommend the center to a colleague or peer or family member? And most employers and vendors that I've worked with seem to want to make sure most of the responses are within 8 to 10 or 9 to 10. And many times that's even part of the performance agreement that's made between the two parties. And also, you don't want to forget, you want the views of the doctors and the hospital, the nurses, the medical staff, and medical assistants in their satisfaction. Sometimes they don't like the work environment. Sometimes they have trouble with materials, or they are not getting reports, or they need additional resources, or maybe they're not being fully utilized. So you really want to get a feel for them and their processes as well. Is the EMR working? And what about communication? You want to ask, again, the HR staff and benefit staff who made the original contracts, how they satisfied with their account manager, with the center's performance, with the reporting, the timeliness, and responding to issues and things like that. Also, you might want to consider taking a look at the online tools that people have, like Yelp and Health Grades, where you don't control the questions, you don't control responses, but sometimes people will post comments. And what we find is people's subjective ratings often tie very closely back to a representation of what happened, at least from their perspective. Now, clearly, when you ask about did you get good quality? Some people think, well, if I could park closer or they had nicer TVs in the waiting room, that's quality. Now, for those of us who've been in this a while, we know that that's not reflective, but it is part of that patient experience. And since traditional surveys only cover certain aspects, sometimes looking at these online formats, looking at testimonials and other things can make a difference. So when you're looking at things, you also have to understand that people's responses are adjusted and reflected by different things, such as, did they hear good and bad or bad things about the clinic? What is the word of mouth, particularly from peers? We know that peers and family members have the greatest influence on someone's decision about their health care, where to get care, how they get care, and things like that. Testimonials from people who have used the center and have had good experience, and that you put in newsletters or in other communication settings can make a huge impact in getting people to use the center and then to adjust their perspectives of it. The kind of staff and provider engagement, how much respect, how friendly it is. We know the number one reason most clinics fail is the staff, is the providers. providers who don't understand the setting they're working in. They don't understand the corporate culture. They don't understand the patient culture. They don't understand the task that people have. And they only focus, they from a typical setting, like in a doctor's office, and they don't look beyond the four walls. They don't spend time really integrating care. They're still thinking how many patients they have to see. That's why we always recommend that an employer interview every provider that a vendor or health system wants to have working in the center to make sure those providers will fit in well. I mean, we've got some employers, for example, who require providers to be on t-shirts, shorts, and roller skates because many of their population get injured in the ball field or playground outside or whatever the case may be. And if or to go to the factory and to give flu shots where people are working rather than require them to come into the office. So the expectations you have for providers and how they're meeting them is something the benefit people and the patients will talk about. The culture and leadership of the organization, if senior leadership is not utilizing the center, if people don't hear testimonials from them, if they don't see them there, it's going to adjust their satisfaction and their interest in using the center. The quality and experience. This is a whole different kind of setting. And so the patient experience should be much better than they get in the community. We know when people have to get care and have to leave work, they're gone 3 to 4 hours, they travel, they wait in the provider's room or wherever they're getting care. We want to make sure that the care in the worksite center is totally different and it's much more patient focused, getting people in and out because they have to get back to work or they want to have a very short time period. The access to care is what drives so much interest. And so you want to validate, are people getting quick access? Are they satisfied with the ability to get in and out quickly? The whole environment. You don't have to have necessarily a high-end center design, but it should be welcoming. It should be friendly. It should be attractive. The waiting room should be something that people don't have to wait very long to. The examining room should be something that's clear and easy for people to use. And again, they don't have to wait there long. The kind of technology you use, both in enrollment and processing, and frankly, in collecting your satisfaction information, all can have an impact. And of course, the social determinants, the social demographic issues like age and outcome and culture and race and language and economic, all can play a role in how people respond both to the care they're getting and to satisfaction and experience surveys or tablets that you ask them to do. So when we survey our membership, these are the main areas that most people have been surveying on. Number one has been, what's your satisfaction with the providers? Secondly was, would you recommend, were you satisfied with the care? And then third, would you recommend the clinic to other people? Then satisfaction with the appointment process, et cetera. As I said, some of the hospitals who offer care were also using Press Ganey or CAHPS measures, but not that many. So in general, in the sum, the lessons learned from members who have had on-site, near-site, the shared centers have been, decide on your objectives to the center and then measure the satisfaction with those objectives. If you are focusing on better access, better care, better communication, better integration of care, reduction in emergency room use, you want to find out, are you meeting those? You want to create measurement approaches that work for you, that based on the data you've got. Don't try to drill down and look at things where you don't have data for. Look at what you can measure. Define the numerators and denominators. And when I say that, I mean, sometimes, how do you define a patient? Is a patient a person who's been in the center one time, who's been there for all of their care, who has got a personal provider there? That will make a huge difference when you look at trying to determine percent of responses. So you want to make sure that the employer and the service manager or health provider agree on what are those numbers and how are we going to define that care. You want to make sure that the vendor provider understands the employer objectives. What are their measurement needs? What do they have the tools to collect satisfaction in the ways the employer wants, to collect patient experience information? Also, performance guarantees should be set up to link back with these measures. And in fact, what I recommend is even before you get into a contract, the employer in its RFI, request for information, should be saying, these are the things we are looking to gather about satisfaction or other areas. Before you bid on us, we want to make sure you have the capabilities and the interest in doing so. And then you tie that back into the contract, because you don't want to get to the contract negotiation period and the vendor and the employer don't agree on approaches or the ability to do certain things. You want to set appropriate expectations for VOI and ROI with your senior managers, because there's some things you'll be able to collect and others you can't. Now, clearly, satisfaction is something you can collect very frequently, and you should be monitoring those results on a quarterly basis at a minimum, especially for a new clinic. You want to see what some of the issues are, maybe monthly, to determine what's going on. And then you want to use those results to get whatever changes or improved resources. You want to monitor that, and you want to make any kind of changes as needed. So with that, I'll stop there, and I'll ask people on the call for your comments. And so I'll just call on you as you show up in my listing here. So let me start out with Joe Briltano. Joe, comments or questions, and unmute yourself, or things you want to share.
Yeah, hey Larry. Thank you. That was great. Just a quick comment. I was wondering what others use in terms of patient surveys. I use Microsoft Forms, and I have it connected to a QR code across our clinic. And the Microsoft Forms is a great tool because it automatically calculates NPS for us based on, you know, if they're a promoter or not. I was just wondering if there's any other, you know, good survey tools that other members of NAWHC have been using.
So if anyone can speak up, unmute yourself, please.
Just survey tools.
With on-site care, I guess I would say we used to use SurveyMonkey in years past, and then we found that it was more efficient to combine our patient satisfaction surveys with our EMR. So our survey questions, which is a set of 5 questions, is sent out by text message to all our patients through our EMR, which is eClinicalWorks. And we gather that data, which includes an NPS score and a report from there.
Great, thank you.
Yeah, we have some members who have tablets, and as people leave the office, they're asked to complete the survey right at the office there as well. Or sometimes there's a follow-up email that the staff sends out or that's generated automatically that goes to them asking for a few quick questions.
Thank you.
Anybody other comment on the tools that you use? Not Joe, anything else you'd like to question or ask or share?
No, I guess we leave it at 3 questions just because we like to tell them, hey, by the time you get down from the elevator to your work floor, you'll be done with this survey. But I think that PowerPoint made me rethink some of the questions I am asking and maybe ask for what else we could improve to kind of always looking, to grow our services or adapt. So definitely going to add another question. So it might take 45 seconds instead of 30.
Yeah. Have an open-ended question is always helpful as well. Yeah. Thanks so much, Joe.
Thank you.
All right, Tony, your thoughts or questions? Anything else you want to add or ask about the group?
No, I guess as our experience evolved, first of all, I think you hit a lot of great points, Larry, and we've certainly found a lot of those points useful as we've adopted them over the years. I think that in line with what Joe just said, we used our survey to patients used to be 10 questions, and we used to send those out by email, and we found our response rate was not great, and it did improve. I don't have numbers, but it improved quite a bit when we moved to a text message system in line with how people communicate nowadays, and also reduced down to 5 questions. As far as the types of questions we ask on that survey, I mean, there's the NPS question about the global experience. There's satisfaction with provider, satisfaction with MA interaction, and and how quickly they were able to get an appointment. Get that, and I'm blocking the fifth one, but and we've been fairly satisfied with that process in recent years, and our clients are appreciative of that information. Otherwise, in terms of VOI, and I'm not, directly working with that that information that's shared with our providers. I certainly see it and review it. And I know that our VOI reporting over the years has evolved to include, I guess, a division between what can be directly measured and reported along the lines more of ROI, but then using certain assumptions that are based on national data, in terms of how much time patients spend with providers, ER visits for diabetics. I mean, we incorporate some extrapolations from national data into our VOI to compare how on-site care is doing to some national standards, if you will. And we make it clear in our reporting that part of the VOI that is directly measurable and in terms of dollars and cents, and that which is based more on assumptions based on what we know from community health. So that's been, I think, valuable in our interaction with clients. You're muted, Larry.
Thanks very much, Tony. Abby Stenrud, your questions or comments? Things you want to share, Abby?
No, I don't have any questions. Thank you.
Okay. Jennifer Moore. Jennifer, any comments, questions, things you want to share? Jennifer? No? Okay. Anne Marie, any comments or questions you'd want to contribute for us?
Yes, thank you so much, Larry. That was really, really informative. In comparison to some of the topics that you brought up at Novant Health Employer Solutions, we follow the same protocols for our clients in the NPS score that we provide, gather information, along with additional questions such as, did the clinical staff communicate effectively? Did you felt like your needs were met during that visit? And then in addition to those types of questions, we also ask, are there any additional type of services that you feel that you would benefit from while visiting that clinic, or any other different opportunities to learn or to have engagement with the on-site and wellness team? So we also try to gather that information and then report back to our employer quarterly on those, possible opportunities for further engagement, as well as patient satisfaction while they were in the clinic. And then to Tony, your point, also looking at clinical dashboard data, that's part of our reporting process as well, looking at major things like BMI and tobacco status, as well as blood pressure status. So that's also part of our reporting. In addition to the return on investment that we also calculate and take care of and report on. So pretty much in line with you had mentioned everything, Larry, and that was great. My question that if we have time to look at is a little bit more about gearing the questions toward our employer, our client, and access to getting the survey to them a little bit more effectively. I know we're all surveyed out. When patients visit our clinics, we hand them an iPad on their way out, so that we get their feedback instantaneously. As opposed, in the past, we did emails and texts, and we kind of right now currently are getting it on the spot, which has been really, really helpful. And we use Aladen Insights. Formerly we used Qualtrics and SurveyMonkey, and now we switched over to that. But a part of our reporting process, we get our information, our patient satisfaction from the employer. Any suggestions on more effectively getting feedback from the employer, from the client? I think that would be helpful.
Well, let me ask you, do you have quarterly meetings, or how often do you physically meet or have a Zoom meeting with the employer?
Quarterly meetings.
So that would be the time I would present it. I would, on your agenda of items you're going to cover, I would suggest you have something on the, either at the bottom or at the top, and say, you know, what are your concerns or issues that we've not covered or that you want us to cover in future meetings?
All right.
Yeah, responding to surveys, employers, they don't open it. They don't see the emails. It gets lost in the avalanche of time. When you have your face-to-face where you're actually reporting on the performance of the center, that is the time to directly ask them. And I think they'll appreciate that, definitely, for sure. Anybody else want to comment on how you get employer input? No?
Okay. Thank you.
Sure, you're welcome. Thanks for participating. Melanie Small, any comments, questions, or things you want to share?
A couple of things. I appreciate the conversation for sure. And one of the things that we do when you're trying to get employer feedback is that we have 3 times a year, our clinic team goes into the workforce and goes out into the areas and attends staff meetings. And that has been incredibly helpful for driving in business, as well as for getting feedback on things we could do to either change services, increase services, etc. So that's one thing that I would suggest if people are able to do that. One of the other questions that we ask when you talk about a survey, one question we ask is, what would you have done if we weren't here? And we get really great feedback that we share with the employers that we work with, from nothing to an urgent care to emergency room to wherever. And it's great data to show them the value of having the clinic there. So that's my comments.
Great, thanks so much. All right, Jennifer Moore, let's go back to you. If you put on mute. No, still, all right. Thanks so much. Bo Evans, if you're still on the call, any comments or questions, things you want to share, Bo?
I was just gonna, hopefully you can see me. I was just gonna back up what Melanie just said. So at Pfizer, we staff our own on-site clinic, and we do the exact same thing where we ask, what would you have done if not? And I think that's really useful. The other piece I would offer, I was thankful to see NPS as part of your presentation, Larry, because we feel as though, I interact with our human resources department, and we feel that it's important to speak the CFO's language. And so we can clearly compare ourselves to other cost centers with financials, but some folks don't have a cost center. And so it's really nice to use NPS to talk about the end results from something that's, relatable to what the CFO sees every day. So no real questions, Larry, but just sharing what we do inside of Pfizer. So thank you.
Yeah, I couldn't agree with that statement more. We have done studies of CFOs and financial directors and managers, and you got to speak their language. You have to speak in hard data, in hard information. So, for example, people used to report on presenteeism, the time that people were at work but weren't functioning well. Well, CFOs, they don't understand, they don't accept that. So you had to talk in replacement workers, absence, things like that. So when you share information with them, it's really important to be hard if you can.
Yeah, Larry,
Go
we
ahead.
tried to cut out all the isms. The isms were killing us. And so whether it be absenteeism, presenteeism, we tried to cut out our isms. So thanks, Larry. Thank you.
Gotcha. Carmen Cook, comments, questions, things to share? Carmen, take yourself off mute, please. Okay.
Oh, sorry, my computer wasn't letting me unmute.
Go ahead.
No real questions. Just more of a comment of really agree with all the comments that are being said about like member satisfaction and participation. Another thing that we usually try to push or more try to request of the vendors that we work with is to provide more outcomes-based data. So a lot of times the clients are focused on engagement and are they using the clinic? But we also try to push them and help them like open their minds to outcomes related data. So is blood pressure decreasing? Are they better controlling their weight? Are better management of diabetes, things like that. So trying to get our clients to expand past the engagement and member satisfaction and trying to drive down or trying to nail down the different outcomes of the clinic to also help further elaborate on the value on investment.
Thank you, Carmen. Could you also mention a little bit, somebody asked about the kind of tools used to collect that information. What does Mercer recommend to collect the information and when you collect it?
Really depends on the client and the vendor. I personally haven't had a client yet that uses Microsoft Forms with their clinic vendor to collect a member satisfaction survey. A lot of times it's given through their EMR. Some clients have I've seen some clients have issues with being able to use like Microsoft based applications. So in some instances, I've seen like the creation of just a basic tool in Excel to gather member data. But outside of that, I wouldn't say there's necessarily a Mercer recommendation. It's whatever works best for the vendor and the client.
Gotcha. Okay, thank you. Jennifer, your comments or questions or observations? Take yourself off mute, Jen. Thank you.
Hi, Larry. Hi, I'm just enjoying the conversation and definitely taking note of the value of the NPS. I thought that had some good insights and, continuing to take note. Nothing further.
Okay, thank you.
Thank you.
Sure. Lillian, I'm sorry, you were jumping off. Do you have time to make a comment or question before you leave? Okay. Steve Skrocky, Northern Penn, comments or questions, Steve? Anything you want to share?
Hi, Larry. No, I'm just enjoying listening in. I have nothing else additional to add. Thank you.
Okay. Tony Perky, any comments, questions, things you'd like to share?
I'll just say for the employer side, I've heard a couple of people mention getting surveys from the employer. That's always the tricky one. Patient satisfactions are pretty easy, but with the employer, there's a couple things you got to watch, and the number of respondents matters, right? If you only do a survey to one respondent or two respondents in an employer, and that somebody gives you one little negative thing, you could drop drastically. So getting a true picture of what your client satisfaction is a little more difficult. And we always recommended you do it as like an aggregate of all your clients for the employer side, so you'd have a more realistic picture. But I know a few people said they had trouble getting responses from employers. I never saw that. Onto the client satisfaction surveys.
Great. Thank you. Thanks a lot, Tony. I think I've covered everyone. Melanie Small, I don't know if I called on you. Melanie, your comments, question?
You did. I already commented.
Okay.
Thanks.
All right. So let me just open it up. Anybody else have comments, questions, or things they want to share with the group? Let's leave the microphones open.
Hey, Larry, this is Jeff Kessler.
Go ahead, Jeff.
Yeah, really good conversation. It's always good to hear what the worksite clinics are dealing with, and as far as feedback from the patients and whatnot. We've we're in the allergy side of things, so we dive deep into the disease itself. But, ROI and VOI are two measures, obviously, that you try to gather more information on. But another one that we use a tool that the patient can easily, provide feedback over time. So longitudinal kind of information, but we also look at quality of life information. So we found that to be something that's more in that VOI side of things, but really important. But this has been a great conversation, and thanks for everybody's input.
Great, thank you. And so let me, Joe, I see you've got two other people with you at your office. Anybody have questions from your group there?
No, I don't think so, Larry. I think we're all set. Thank you so much.
All right. Well, let me thank everybody for participating. A copy of the slides and a recording will be available to everyone here in our membership. Please do participate in upcoming programs and hope to see you at the annual forum in August in Indianapolis. Thanks, everybody. Stay
Thank you.
warm, stay cool, actually, depending upon where you're at, and watch the rain. Take care. Have a good weekend. Bye-bye.
Thank you.